We hear from patients every day, consumers, we survey them widely. They want care where they want it, when and how, more so than ever before. And as healthcare providers, we need to listen to that.
I think the really interesting question about retail medicine and whether it can systematically move up market here is, do they have the right business model and the simplifying technology to genuinely compete with large incumbent health systems or complement large incumbent health systems?
Increasingly, we see ourselves in the knowledge to delivery business, and this opportunity to think about extending the model to care for people and patients where they are, really connecting with people where they are, is very much of a premise of the work that's going on in the Center for Innovation.
We're evolving our model from acute episodic care, convenience for simple things, to a much more complex type of care that still is relevant and still is possible in a retail clinic setting, but in partnership with health systems and physicians, and focusing on the strength of our locations, our nurse practitioners, and the ever-growing role of the pharmacist in helping with health and wellness. Now we think about things like chronic diseases and the patients that are coming into these pharmacies and drugstores 12 times a year, sometimes 48 times a year. What else could we be doing at Walgreens with our clinics, with our pharmacists, to be monitoring those patients, to be intervening in some of their compliance and adherence to medications, to be doing physical exams or checking their vital signs. And we've just scratched the surface, I think, of where that goes.
We simplistically think of healthcare in a jobs to be done perspective. What jobs are patients trying to get done in their lives for which they hire the healthcare system? And we think, again, very simplistically, there are three. There's the job of, I think something's wrong, I need to figure out what's wrong. Diagnostic job, right? There's the job of, I know something's wrong and I need someone to fix me. That's a treatment or therapy job. And then there's a keep me well job, which we usually forget about in most of our lives. If you think about the healthcare market in terms of serving those three jobs, right now people usually only get paid in the healthcare system for serving the second one, treatment. There are new technologies coming, one like Theranos for a point-of-care diagnostic system, or there's a multitude of health tech startups, that I won't go through the litany of them, who are enabling stakeholders like employers and even patients to evaluate quality and price for the specific diagnostic job that they're trying to get done, independent of treatment. So I think we'll see in the future a fragmenting of these three jobs into independent business models, whereas currently in the healthcare system, they're predominantly bundled into the business model of whoever can get paid for treatment.
We've been building a very diverse group. We now have a team of almost 70 people. And it's really around thinking differently. So we've brought designers and anthropologists and physicians, and really trying to mix up the idea of design thinking, trying to deeply understand user needs of our patients and people, to then drive the models and the services that we're building out. So we really don't start with sort of a shiny technology or completely understanding the business model. We really try to have faith in the process that as we iterate and co-create the models with the patients and people we're trying to serve, that we'll get there through the process and the methodology.